Good morning, folks, and welcome to Black Pines broadcast. I'm Dee Grimes, and I want to thank you for listening in. So, our annual festival culminated last week Monday, and there was an uptick of COVID cases, as expected. 5 people have gone missing within the past week, a highly unusual occurrence. Over the last 8 days, a prominent senior doctor has had their license suspended. One of the 2 coroners on island have gone on leave for an unspecified length of time, and 2 doctors have been removed from their surgical internship at the island's main hospital. There is also a very troubling video circulating on WhatsApp. It was released by a young woman who was recently discharged from the quarantine facility in the north of the island. She witnessed a man experiencing some peculiar symptoms that made her question if that particular facility was actually the most appropriate for him. She believed he needed to be in isolation, but not because of COVID. Now, you may not be thinking that the aforementioned things are related, but dear listeners, it seems they are all connected, and by someone I have dubbed Patient 13. A young lady, let's call her Miss X, that circulated the WhatsApp video, was recently discharged from quarantine for COVID. During her stay, she noticed a man who was brought in very late one night with some strange symptoms. He was placed in bed 13, which was next to her. He had a cough, but it was slight, and he seemed to be constantly drifting in and out of consciousness. He was not on oxygen, she reported. Early the next morning, Miss X observed some strange growths on the man's skin. She said they looked like little mushrooms, and they had erupted all over his body, including his eyelids. Miss X understandably began to worry, especially after overhearing a conversation between 2 nurses that the man had yet to be identified. He had collapsed at a fete the night before, and there was no form of ID on him. His picture was sent to some hotels and guest houses, and one of them had responded, recognizing him as a guest. But a search of his belongings did not turn up a passport or any form of identification. There was approximately $40 in local currency, no debit or credit cards, no jewelry, no cell phone, no medications or personal hygiene items, no tangible evidence of recent travel, only clothing and shoes. Miss X said a couple days later, 3 more patients were admitted within an hour, and they had similar growths on their skin. They were scratching uncontrollably, and their hair was coming out in patches. A doctor came in that day with a very heavy accent and performed tests on every single patient. He said they were retesting for COVID and also monkeypox because a patient had tested positive for the disease. 3 vials of blood were taken from everyone, and Miss X said she was told her tests were negative, but was still concerned she was going to catch whatever the other patients had, which she was convinced was not monkeypox. Now, sometime after breakfast was served the next morning, Miss X said she was roused from her sleep by a commotion. Patient 13 had simply vanished, and it was pandemonium as staff searched every millimeter of the facility for him, but no one, not even the patients nearest to him, saw him leave. A couple of the patients, traumatized by the bizarre disappearance, had to be sedated. How could patient 13 have left without a single witness? Now, there are some loud whispers that the prominent senior doctor who worked at the island's main hospital that had their license suspended, the coroner, who was said to be on leave, and the 2 junior doctors removed from their internship were actually fired for carrying out autopsies on persons who passed away from COVID and conducting unauthorized diagnostic tests. And rumor has it that the senior doctor is building a legal defense upon supposed data that the patients the autopsies were performed on had false positive COVID results, and it was believed those persons had a rare and very serious infectious disease, and there was proof from results from samples that were rushed overseas for testing. The health ministry has described the behavior of the severed employees as egregious, erratic, and unforgivably irresponsible for acting upon ludicrous hypotheses. They have also issued an emphatic denial of covering up the existence of a serious infectious disease and investigations of such. The 2 junior doctors who are not from the island have returned to their respective home countries. So, folks, would a group of doctors risk their careers on a flimsy foundation? One would like to believe that there must be a preponderance of evidence that will propel them to make such life-altering decisions and be willing to suffer the imminent consequences. And such belief naturally comes with the burden of there possibly being a very disturbing truth that is being concealed from the public. Four persons who were quarantined in the north have been reported missing. All of them were reportedly formally discharged in good health. It is said they also had strange skin growths. I tried to reach Miss X today, but I was informed that she had been transferred to an overseas branch of the company she works for. It is unclear if the transfer was by choice. Who and where is patient 13? According to unconfirmed reports from authorities, review of video footage did not show once any sightings of patient 13, although wait staff and housekeeping staff have verified seeing him several times in areas where there are no blind spots. The receptionist who was on duty when patient 13 checked in has quit her post and has declined to speak with the press. A member of the housekeeping staff, who wished to remain anonymous, claimed she saw large pieces of skin in the shower of the room of patient 13, but several people have dismissed her testimony because of a strong family history of mental illness. A berriffle of questions and not an answer, folks. Do we have a smoked red herring situation here? If you find a fish fighting alongside a shark against sea urchins on land, which oddity would you find most intriguing? How and why the fish and shark became allies? Or the fact that a battle amongst sea creatures is taking place out of water? What are your thoughts on patient 13? I'll talk to you soon.